go to Africa Health Week and also Future Health on LinkedIn, Twitter, Facebook, and join in the conversation there. And talking of conversations, we will be very shortly in conversation with Marc Gregory. But before we ask him some questions, we'll go to him very shortly. Just to let you know, Marc is CEO of Ollie Health. And what he is going to say is all about mobile healthcare currency for the remote workforce. Here he is now.
A huge welcome to everyone that is joining my talk. I'm Marc Gregory Knowles, and I hope that you have a strong cup of coffee. I understand that virtual conferences can be a little bit different. They're not the same, but I promise that I'm not going to throw statistics at you or technological jargon. I really just want to take you through our journey as a team and what we think is the future of healthcare service delivery and how we're building a mobile healthcare currency here in South Africa for the remote workforce. There's a Zulu battle code called Impi, which implies that no chief can send out a soldier into battle without a weapon. Now, considering that the Zulus were incredibly innovative, they had shorter, larger weapons that allowed them to be more mobile and more flexible. And I think that there ought to be a similar specification for the youth and students on this continent, that we arm them before they go out to study, and that before they join the ever-adapting workforce, that they have access to primary care, that they have access online to healthcare providers that is on demand and that is tailored to them no matter what, no matter where they are in the country or in the continent. And this is because your success in life is largely due to your mental and physical health, how much you can build and contribute to the community, and the quality of your ideas, the quality of your decisions, in that order. And the first step is allowing access to primary care to the youth of our country and to the youth of our continent. But in reality, we have a massive healthcare scaling problem. In South Africa alone, 80% of our population just doesn't have access to primary care and private primary care. Our public healthcare systems are incredibly overloaded, and the way that the system is designed is complex. There's third-party insurance, medical aid providers, and a lot of these medical aid schemes were designed 15, 20 years ago to sell to big corporate companies that would then cover these packages. But companies don't do that anymore. And as family budgets shrink, a lot of people don't have access to these medical aid schemes. And we believe that there needs to be a more direct, more technologically focused solution to this problem. If we look at healthcare today, it's incredibly limiting. If I'm a worker or a student, I have to take 1 or 2 hours out of my day to catch transport, to go to a physical clinic, to be in a waiting room that is often overloaded. And this process is incredibly limiting. If I have access to a public clinic or a private clinic, I'm also having to pay upfront cash if I'm not on a medical aid scheme to access a once-off appointment with a primary care provider. And this is how we see healthcare tomorrow. What we call a productized currency. This is a completely new concept in which we take the new service model of healthcare to the mobile generation. Now, if I'm completely honest with you, telehealth alone and technology alone won't drive change. We need to create new service models that deliver healthcare in a way that is scalable and has mutual transactional value. And what we are creating at Ollie is a simple model where an employer will get paid a small monthly fee to join the platform as a member. And being a member means that you get access to these credits. And these credits you can redeem services on the app, from an in-person appointment to a physical appointment. This becomes a new currency in which you get credits upfront. As a patient, you are never having to think, do I have cash to go to a general practitioner? Do I have access to a mental health practitioner, but I don't know where to start, and I don't have the continuous budget to go for 1, 2, or 3 mental health sessions, which is what is required to have a sustainable diagnosis, or even just support. As we've seen with remote work, the burnout levels are incredibly high. And as a 23, 24-year-old joining the remote workforce, it's incredibly stressful. You have a support system of one. We call this a productized internet native currency. And we believe that this transactional value will actually open the access of healthcare for the younger generation. Now, if we look at mental health as a category and a use case for telehealth, I think it's vital to understand the immense amounts of pressure that there are on young workers and students. If we look at the statistics on how much mental health is mentioned in earning reports, it's unbelievable post-pandemic and mid-pandemic, the importance that is being placed on mental health. Employers are burnt out, and the access to mental health, there's a massive stigma, whether it's cultural or whether it comes from your family, around mental health and the support that you can get. Now, growing up in a house of three women was definitely interesting, and a few of my family members have struggled with mental health issues, and I never really understood it until I decided to take the massive leap and go work for some startups up in Toronto, Canada, in the depths of winter, coming from South Africa by myself, going up to a completely different climate and culture. The startups there had a 996 principle, which was you start work at 9 in the morning till 9 at night, and that's 6 days a week. I believe that's taken from a culture that originated in Hong Kong. And it was after months of this work and little interaction with anyone around me that I really understood the importance of having someone to talk to. And I realized the mental health struggles and how I wish that I had instant access to someone that can support me. And I think that is an incredibly important point that we want to drive home here, is that a mobile platform will allow for more distribution for young people to access on-demand mental health. You never have to worry about, do I have enough cash? Do I have upfront cash? Do I need to claim back to book this service or appointment? It's an on-demand service where the credits get redeemed within the app. And on the service provider side, whether you're a GP, a psychologist, or a therapist, it's a new form of revenue where you get paid out directly for that booking. And it actually becomes a whole new service model for you as a practice of one or an entire clinic. Now, we understand that we have a long way to go, but if we zoom out and we take it Africa, its scale is incredibly amazing to grasp. I mean, the whole of Europe, China, the continental United States, and India can fit into this continent. The population size is unbelievable. We have a massive and powerful growing middle class. But we do have capital allocation challenges. In fintech, you often see bank the unbanked, but I believe that the problem isn't a technological problem. The problem is you can't bank the unbanked if they don't have income, if they don't have health to get income. And I believe the challenge is the same in healthcare. The technology itself isn't going to drive any meaningful change or adoption. We need to have a completely new system and way that patients can easily access and are incentivized to access mobile healthcare that's sustainable, that they can build data as they grow and as they understand their healthcare needs. I thought this would be really, really interesting to include and perhaps conclude on, is if we look at the ecosystem in South Africa, our company's just closed a pre-seed round, and I know how incredibly difficult it is to raise capital as a medtech startup. If we look at raising capital in other parts of the world, the capital allocation is just vastly different. And although this is growing in the first sector of 2021, the amount raised over 12 months is at 77.1 million USD, which is still about 1% of where this capital allocation can be for us to have empowering teams to build and challenge new types of technology in the space that provide mutual value for the patients and for the providers. Thank you so much for listening to my talk. I hope that you walk away from it thinking of technology not as an incremental improvement to your practice or to your everyday life, but rather the directional arrow of progress that Africa as a continent is moving towards, and how technology can completely rebuild the healthcare delivery network, and how a currency can actually incentivize mobile access that is more affordable and accessible from the comfort of anywhere in Africa.
And here is Marc now. Hello, Marc. Where are you today? Hey, Marc. I think we might have missed that one. Can you just say that again? Where are you today?
Yeah, sure. Hi, thank you so much for having me on the Q&A. I'm working from home remotely today.
There you go. So you're the perfect example of what you were talking about in your presentation there. I'm not sure I quite understood or heard that funding method, if you like. So refresh us. Did you say that the employer joins the platform as a member but receives a payment for that?
So how the system works is very simple. The company, let's say if you have a team of 25 members, the company will then give the employees access to a membership. So it's a small monthly fee between 300 and 500 Rand that they pay for each employer. And then that employer then gets access to all of the credits up front, whether it's for 6 months or a year. Then they get access to those credits, which they can immediately use to book an appointment and redeem on the mobile app.
And do those employers come to you readily? Is there any resistance?
I think we've seen a huge kind of shift towards how can we give employee benefits, especially to remote workers, and but there's kind of a mechanism where it's either old organizational kind of employee benefit structures, which can be quite complex. So they're looking for something that's flexible and, of course, affordable, and something that can drive the overall bottom line of the company. But I think we're seeing not just HR managers, but company directors are incredibly more empathetic towards burnout and the need for their employers to have some kind of anonymous support system where they can try alleviate organizational burnout. And that's really what we're trying to provide, just something that's easy and accessible for companies.
And I think there you're absolutely right, where employers are seeing the benefits, aren't they? They don't want their staff to be unwell, they're not productive, they may take time off. So it's in their interest, isn't it, to make this investment to ensure that their workforce is happy and healthy, both physically and mentally.
Absolutely. And I think companies have seen that weren't remote first. As they made the shift to remote, productivity actually increased, which was amazing and a huge surprise to a lot of bigger companies that thought it would be a massive challenge. But then I think over time, the realization of, burnout and mental fatigue and the lack of connection between employees, your company is your team. And I think the value of that, there's a global network of employers. And, I think the ability to retain your employees is going to be increasingly more important. And to give them access to primary care is a mechanism that they can help retain employees.
I think a lot of this really came into focus, didn't it, during the COVID-19 pandemic, when people were encouraged to stay at home, even told to stay at home, that some were told to carry on working. And at first, you would think that would be a bit of a dream. Oh, I can just wander straight from my bed to my workplace. I don't have to commute. But you've highlighted there that over time, there are elements that you miss. You miss the interaction, you miss the camaraderie, maybe just talking to a colleague over the water cooler about an issue you might be having. And so some of those services that you're seeing paid for are the ones that perhaps are most in need because of what's happening in the world.
Absolutely. And I think, we want this access to primary care to be not just about diagnostics, where, a lot of employees, they're not reaching out to mental health professionals or going to a GP because there's a stigma around well, I don't suffer from depression or I don't have a chronic disease. But we want to actually have a system that supports you and acts as a support network where it's not just about diagnostics, but it's about continuous support. And our vision is that we want to have employers have instant access 2 to 3 times a week throughout the entire year to have that conversation with a mental health practitioner or reach out to a GP. So we're incredibly excited to build and develop the product to access more and more people in South Africa and Africa eventually.
And quite often, I mean, you mentioned there, about a reluctance maybe to come forward and say you have a mental health issue, that quite often affects men more than women. You highlighted that idea of growing up in a household of women. And actually, those initial conversations are probably the most important, because if you leave it too late, then, you really do struggle, don't you?
Yeah, I think it's coming to terms with the fact that, you're working hard, especially if you're working in a smaller team, a startup or a bigger company. There's just a lot more pressure to perform. The pace of work is increasing, which increases expectations. And we're all human. And I think, if we can help, it's not just good enough to educate people on breaking that stigma of reaching out to a mental health provider. I think we actually have to design a new system, something that incentivizes people to really take responsibility and make it feel like this is a safe space outside of your work to actually have these conversations. You can use these credits and you can actually build, data over time that's going to be incredibly valuable to you and your employer.
You mentioned there the 996 working pattern. For a lot of people, they feel like it's now become 24/7. With technology comes some sort of urgency. You get an email, it might be 11 o'clock at night, you feel like you have to respond to it, especially if it comes from your boss. What would you say to that? Do we need to change our thinking around this culture?
Yeah, I think a large part of it is to blame. The tools get blamed, Slack and notifications, that little green symbol to make sure that you're always online. Even if you're making a cup of tea, you quickly move your mouse to make sure that you're online. I think those behaviors, over time, it needs to come from the top down. It needs to come from true leaders and managers in the organization, that it's still about building output and creating value. It's not just about being the fastest to reply. I think the tools aren't necessarily to blame. I think the culture comes from the top down. And if a company can say every member in this team is important, your mental health is important in order to produce great work, truly amazing work, and by offering these services, we believe that hopefully it'll kind of promote a new type of workforce culture that is not just obsessed with performance and data, but actually building meaningful relationships and a positive work culture, whether that's fully distributed, fully remote, or at the office.
And I guess it's about those leaders, as you say, senior managers and the others, that two things really, I suppose. They've got to trust people. Because quite often, certainly in my era, everybody had to go to the office because then we knew where you were, and we could keep an eye on you, and it felt a little bit like that. So there's a trust issue, but also understanding individuals. Some people work better in the morning, some people need a nap at lunchtime, some people are better working in groups and they get more creative. And I guess, especially with a remote workforce, you've got to grasp all of that trust and individual needs.
That's an amazing point. One of the questions, we found that we need to ask kind of better questions instead of saying, what is the deadline or when can you have this done by? We often ask members in our own team, if you had to have an ideal day and you had to put aside 3 to 4 hours, what would that mean for you? Is that getting up at 6, going for a walk before and really getting into deep focused work? Is it more in the evenings, once you've dropped the kids off at school or you've picked them up, you've spent time with them? I think it's completely kind of subjective to how that person incorporates that workflow. And I think by asking those questions just from the start, I think we can kind of set a better culture.
Yeah, and get the best out of people, and as you say, move forward together. I think there's a lot of traditional work practices that have to be dismantled, aren't there? An education then process of leaders about how things can be different, especially because, as young people come through, they have different ideas. They're questioning, aren't they? More and more, they're disruptors. They're saying, well, why does it have to be like this? Why? I see workplaces now that have got beds so that if you're tired because you had a late night, you can go and have a sleep. But if that makes you more productive in the hours that follow, there you go. Whereas back in my day, you'd be sacked if you were found sleeping in the toilet or something.
Yeah, absolutely. And I think, this remote work culture, we see it as Africa's gateway to the world. I think that we have amazing young talent, but we need to find a way to switch on a revenue stream and a salary for young talent. How do we do that? Distributed work will give access to a lot of African kind of young talent, access to working for a company in the States, the US, Europe, which will be incredible. But I think the fundamental question of, they're not going to be covered by health insurers, especially if you're working for an international or a local company. That system has completely changed. So we know that if you're going to do your best work, you have to have primary care. You have to be willing to put your health first. And that's what we want to try to provide is essentially a new type of medical insurance that it doesn't matter where you are or who you work for. This mobile platform is going to be there for you to make those appointments.
And presumably for young people particularly who are looking for careers or new jobs or workplaces, this is an incentive, isn't it? So if I see that as a reward and I'm a young person, and it is a reward and an incentive, so some might say, as part of this career move, you'll get a free gym membership or access to a company car or whatever they say. If they say these credits are available to you through the company, that's a massive bonus and an incentive, isn't it? Or it should be.
Yeah, I think, when I was working in Toronto, there was certain types of, rewards that you would get and free lunches, free meals. I think in the tech environment, it's incredibly competitive to get really good quality software engineers and programmers. And so, those type of rewards were very much surface level to attract employees, where I think these type of benefits are actually meaningful. That are actually going to showcase that you as a company, you care about the health of your team. You know that your team is what's going to drive success. It's not just the fact that your team is 24 hours all on and can work from 12 different countries and it's diverse. It's the fact that your team can work together and connect because they know and understand that they always have access to a doctor or a mental health practitioner. And I think that kind of level of security can allow you to put in your best work.
You say that they'll always have access. I mean, is it really unlimited, or is it that, again, using another, I'm going to sound like a really old fuddy-duddy here from my era, is that, for each year of employment, for example, in one company I work for, you get an extra day's holiday tagged onto your annual entitlement. So will more credits become available if you get promoted, if you've worked within the company for a long time, or is it equal across the platform and you can have unlimited use?
It's completely equal across the platform. So whether you're a senior manager or you've just started at the company, you will get your credits and you'll get them upfront. So you can choose how you want to use your credits. And if you want to use them exclusively to see on teletherapy, for example, you can do that and it's anonymous. You have your membership, what you do with your credits, how you redeem them. It's not you don't have to request credits from your boss. They're not seeing, how many sessions or how many hours a week you are on a telehealth call. It's completely anonymous and you have that discretion to take control of your own health.
And I think that's really important, isn't it? Because despite what we want to happen, people do judge, don't they? And they'll say, he's always on the phone to this service. There's something not quite right with this person. It's awful, isn't it, to say, but that is the reality with some managers.
And I mean, how many sick days are people redeemed through the height of lockdown in the pandemic? A lot of companies have seen 0 sick days being redeemed. And that's because they're too scared to request even 2 to 3 hours out of their day to not sit on a Zoom call and to go to a doctor, and we're hoping that we can change that behavior.
Yeah, I think you're absolutely right. Certainly when I started working from home, you just trudge on because you can sit there in your pajamas with a cold, you're not infecting anyone, and you're expected to be at work. But I guess that needs to change as well.
Absolutely.
And the data is safe. There's no danger to the data because obviously people are worried about hacking and being held to ransom with all of this.
It's safe and secure. It's not a decentralized network, but we do store it safely and securely locally here in South Africa. Brilliant.
Well, listen, what you're doing sounds amazing. I wish I'd had it in my earlier career. So well done to you guys. Keep up the good work. Thanks for joining us. And for now, wherever you, where are you in the world today?
I am in the Eastern Cape in South Africa.
There we are, in the Eastern Cape. Great. Well, listen, what you're doing down there and for all of Africa is brilliant. Let's hope there's great take up on that, and we'll speak to you soon. Thanks for joining us.
Thank you so much for your time. Thank you.
That's Marc Gregory from Ollie Health. Brilliant innovations that we've heard about, not just today, but over the full 3 days of Africa Health Week. Some tremendous ideas and services that are being provided, things that are being thought through. And it really does feel like Africa is at the forefront of some of the best practice. And that is, of course, what this week is all about, sharing best practice, ideas, educating, learning from others, and growing a network, not just in Africa, but worldwide, of healthcare professionals, people who are interested in our and your well-being and healthcare, so that we're networked throughout the globe, talking about these important issues, making changes so that we can all progress in the future. So there we are. Well, we've had a brilliant morning. We've got a fantastic afternoon coming up for you as well. 2 more presentations to come after lunch. So we'll be back shortly. Enjoy a break, and we'll see you back here in around about an hour.